Official Disability Guidelines, or ODG. We often utilize the official disability guidelines because they are evidence-based guidelines. ODG is designed for clinical practice as well as utilization review and management. Evidence-based research provides the basis for sound clinical practice guidelines and recommendations. The overall objectives are to improve outcomes and patient satisfaction by focusing on restoration of functional capacity through prompt, responsible delivery of healthcare based on the best evidence. To reduce excessive utilization of services and corresponding medical costs. To identify and target ineffective and harmful procedures, thus reducing risk on the injured. To improve clinical practice or utilization management by indexing procedures adjacent to the summary of their effectiveness based on supporting evidence, provided by way of link in abstract form. To automate approval for universally effective treatment methods where appropriate, reducing friction and administrative delays on necessary medical care. To help the injured get back to work in good time, safely, easily, and effectively. To take evidence-based medicine to its logical endpoint, the convergence of health, wellness, productivity, efficiency, and responsible, cost-effective medical care. The ODG acknowledges that they are guidelines, not inflexible prescriptions, and they should not be used as sole evidence for an absolute standard of care. ODG is a good mix of an immense guideline and evidence-based research.